When I look at med spa, I look at it similar to liposuction. Patients come to us with an idea of what they want. And they may come to us with an idea that I want Botox done or I want filler done. And our job is to tell them, show them the bigger picture, and for them to have a plan for the next 2 to 3 years where they have an idea of what needs to be done, what are the goals and objectives, and how much it costs, and plan it out so they can get the results they want with the costs they can sustain. If you're watching this video and you have had Botox done and filler done and microdermabrasion done and IPL done, and you don't feel like you are where you need to be, then you need to come to our clinic. When you come to our clinic, we can create a plan for you that makes sense to you, that gets you to a sustained look that you want. Our philosophy about doing these things is that we give you a look that does not look artificial. We give you a natural look. Med spa means aesthetic services that are medical grade, meaning that they have to be provided by a licensed provider. We always have a doctor on site whenever aesthetic services are being done. Most of the stuff like Botox and fillers and IPL is done by a physician. So we have kind of totally changed the model of how we do things compared to how things are done around us. You know that you're getting a good standard of care. You want to have a doctor available to help you to get the right care that you need. And that is where we come in. You know when you come here, you are in safe hands. Spider veins are these red veins that you see on your legs. I tell patients that spider veins are like having a wet spot on the wall of your home. The reason I say that is because underneath the spider veins, most patients have varicose veins. Just like under a wet spot on the wall at your home, there is an underlying plumbing issue. If the patient is not having symptoms, their legs are not aching, their legs are not sore at the end of the day, their legs are not swollen, they don't get cramps, they don't get Charlie horses, they don't get restless leg, and they don't have any skin discoloration around their ankles, meaning pigmentation, then we only treat the spider veins. We don't look for varicose veins in those patients because those patients don't have symptoms. They don't need the extra treatment. These patients who just have spider veins are treated with what we call sclerotherapy. It's an easy procedure. I probably have done around 100,000 injections over the past 5 years. Sclerotherapy essentially means that we take a solution that burns the vein from the inside. We inject it inside the vein using a very small needle that is almost the size of a diabetic needle that makes the spider veins go away. Doing these injections in the spider veins is more like painting the wall. It is possible that if you get treatment when you don't have symptoms, that you can develop symptoms later. So choose your doctor carefully. If you have spider veins, call us and we will tell you what is the best way to go about it. More treatment is not necessarily the best treatment. Best treatment is what you are looking for, what we think we can fix, both of us understanding what goals we can achieve, and you understanding our capabilities. I got a chance in 2009 to go with a group of doctors to Honduras with the organization Hackett-Hemwall Foundation. It was mind-boggling, the amount of patients who wanted to have their leg veins treated because of leg ulcers, venous stasis, pigmentation. A lot of patients had so much swelling they couldn't walk. There was one lady who had such a big ulcer that used to drain, and according to her, maggots used to follow her when she would walk. And we were able to participate in her health care, fix her legs, and get her to a better life than what she was before we got there. I was a very small piece of the big picture. Hackett-Hamball Foundation has been around for a long time. I, since 2009, have gone to about 11 mission trips in various countries. We go for a week at a time, and we treat anywhere from 1,500 to 3,000 patients, depending on the group of doctors that goes. This is done purely pro bono. We pay for our trip, we pay for our medications, we take our own equipment, we pay for our stay, we take things from here for schools locally, and it is always an experience. People are extremely receptive to us. We feel perfectly safe. They treat us like rock stars, and every time we go, we feel like we will participate in somebody's healthcare. At one time, almost 300 people waiting outside to be seen. There are people who can't walk who bring their chairs so they can sit in the line. And every time I go with this feeling that I am going to contribute some to people less fortunate than me. And every time I'm coming back, I feel like I got more from the experience than I gave.
De aquí de Guadalajara, del centro.
¿Y cómo fue su experiencia durante el tratamiento?
Pues tenía miedo a los piquetes, es la primera vez que sé de esto, pero me fue muy bien. El médico que está aquí me atendió de maravilla. No duele, no duele. Me siento bien. Okay. Agradezco a todos ustedes que están estudiando esto, porque ojalá y se acabaran las personas con problemas como yo.
My name is Dr. Kamran Afzal. I am the medical director for the Metro Vein and Cosmetic Surgery. Today I'm going to talk about liposuction. Our goal is to get a patient from A to B, and A being where the patient comes in, and B being where the patient wants to get to. And our goal is to get them there in the most safest and the most effective way possible, and with the least amount of complications. And that is what we do. Our patients that come for liposuction are not morbidly obese patients. They have a BMI from 19 to 35. Essentially, they have an area in their body that stands out when they wear clothes. It doesn't fit well. Generally, the type of patients that come to us for liposuction are patients who feel like whenever they wear a tight shirt, they look at themselves sideways and they see that their belly is hanging out. Those are the type of patients that would come to us. If the bra in the back is bothering somebody with a pad of fat in the back, those are the type of patients that will come to us. If they have love handles, that mostly guys have that problem, they will come to us. Another common thing that happens is that sometimes the jeans are too tight on the belly, versus sometimes the jeans are too tight on the thighs and loose on the belly. Those are the people that we can help. And then they will come in, they will lie down, I will inject that solution in their belly, in the area they want the fat removed, and just using very small cannulas, suck the fat out. We'll put a binder on them, they'll get up and they'll go home. It's that simple. They are not on a ventilator, they are not out. We are talking, having conversations about their families, their children, while we're doing the liposuction. The setting that we do this liposuction is in our clinic, and we have the heart monitor and oxygen and everything else just to be on the safe side. I think tumescent liposuction, the way we do it here in office, is faster than laser lipo, and I think it's faster than liposuction done in the hospital. Our patients come in at 8 o'clock in the morning, and by 2 o'clock they are ready to go home. They're sitting on these chairs, ready to go home, ready for their ride to pick them up. When we do liposuction, we're not making you lose weight. We are contouring the body so your body looks good. The problem that has happened over the past many years is people say, oh, you have to lose weight, you have to lose weight, you have to lose weight. And there are women who are 130 pounds, and there are women who are 135 pounds, and there are women who are 150 pounds. All healthy, eating right, working out, having good cholesterol and all the good numbers, and the BMI is in a good range. And any one of them can have an area of fat that is disproportionate to the rest of their body.
Okay, my name is Lydia, and for many years I dealt with my varicose veins in my legs, and about 25 years ago I had a surgery done on my left leg, and after a while it came back, the discomfort and pain in my legs, and just my veins were sticking out, so it didn't look correct. When I was introduced to Dr. Afzal's place, and he took care of me, and with his staff, wonderful staff, just after few treatments, my legs felt a lot better, and I can be active, I can work, I can walk, I can do anything, and I don't have that much problems that I used to have with my legs. And it's important for me because I'm getting older, so I don't want to live with the pain and discomfort. So I appreciate Dr. Afzal's care and treatments. Thank you for being for me.
At Metro Vein and Cosmetic Surgery, most of our patient population is women because we have so much trust between us and our patients. We started a med spa. We initially started it off as a separate unit. We called it MetroLife Med Spa. Dr. Sharif is board certified in medical aesthetics. She's a physician, and she started the med spa. She would do Botox, fillers, IPL, microdermabrasion. And then we felt that last year that it was time that we incorporated it into the whole practice. And so now MetroLife Med Spa is now part of Metro Vein and Cosmetic Surgery, where we provide the full range of aesthetic services. Our goal is to get a patient from A to B, and A being where the patient comes in, and B being where the patient wants to get to. And our goal is to get them there in the most safest and the most effective way possible, and with the least amount of complications. And that is what we do.
My name is David, and I am currently in the middle of my treatment process. Today being my third of 4 treatments, my second Scalero, and I've felt a great improvement already. Usually I used to favor my so-called good leg, but now I can basically walk freely on both legs without the fatigue or a little pressure type of pain that I was experiencing before. I'm very happy that I've done this, and I'm not sure why I waited so long at this point, because I have already greatly improved and felt a little bit more like I used to feel. So I think my quality of life may have improved a little bit already. So I'm very happy, and we're about to get underway with the other Scalero treatment, so I'm ready for that today.
If you think about the legs, the blood to the legs goes from the heart through the arteries and it's pumped down towards gravity. And the veins have to bring the blood back up towards the heart against the force of gravity. Veins are able to bring back blood towards the heart because of 2 things. One is the muscles in the leg act as a pump to push the blood towards the heart. And in the veins, you also have these one-way leaflets, these valves that prevent the blood from falling back down towards the feet as the muscles push them up. So instead of having one big column of blood starting from your heart going to your foot, you have many small columns of blood. So the blood kind of goes up and a little bit more up, but doesn't fall back down. If the valves are not working in veins that are larger than 3 millimeters, and these veins that are superficial, they are known as varicose veins. Patients who have symptoms of varicose veins generally complain of leg pain and swelling. Leg pain happens because the blood in these varicose veins is not going up towards the heart, and it's pushing back down towards the feet. And when that happens, there is only so much space in the calf, and that is what causes the pain and discomfort. That is also what causes the swelling in the legs. Think about it. You are up for 14 to 16 hours in a day. You're walking, you're cooking, you're taking care of your children. And when you're standing up, your heart is higher than your feet. And if your valves are not working, over the course of 12 to 16 hours, you can develop a significant amount of swelling in your legs. And you know that when you take your socks off, you see the creases of the socks on your legs. Patients also complain of different types of pain. They may not feel the sharp pain that we generally see, but they can have an ache, or their legs feel sore. They can get cramps, charley horses. In most cases, the pain gets worse as the day goes by. You get up out of bed, you walk around, gravity starts to play on your legs. By the end of the day, your legs are achy, sore. You come home, you put your legs up, your friends call, hey, you want to go out get a drink? Or your husband says, let's go get coffee. We have a babysitter, let's go get coffee. And you say, I kind of feel like staying at home. And if that is because your legs are not feeling so good, then you need to have them checked, because that is exactly what happens. Varicose vein symptoms creep into our life. And before we know it, we have changed our lifestyle because we want to accommodate the discomfort in our legs. And we want to say, this is because I'm getting old. And I will tell you that if you don't have a spring in your step, and that is because your legs are feeling heavy, tired, or swollen at the end of the day, there are surgical and non-surgical ways to fix your veins and make your legs feel better.